At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. A physical exam template is a structured tool used by healthcare providers to document findings from a patient's physical examination. It provides a standardized approach to evaluating various body systems, including vital signs, general appearance, and system-specific assessments such as HEENT, cardiovascular, abdominal, musculoskeletal, and neurological exams. Types of physical exam templates. Number 1, general physical exam template. This is used during routine or focused assessments. It includes the following: vital signs, observational findings, system-specific assessments, additional notes. Number 2, annual physical exam template. This is used during yearly wellness visits. It includes the following: patient demographics, medical and family history, lifestyle assessment, diet, exercise, substance use, screening tests, follow-up planning. Steps on how to use a physical exam template. Step 1. Access or download the template. Access the template from a digital library or download a PDF for printing. Step 2. Record patient information. Include name, date of birth, gender, and other identifiers. Step 3. Take and document vital signs. Record blood pressure, heart rate, respiratory rate, and temperature for baseline health status. Step 4. Conduct the physical examination. Use the template as a checklist to do the following: focus on relevant body systems. Document both normal and abnormal findings. Skip systems not relevant to the presenting issue or marked as not examined. Step 5. Include medical and lifestyle history. Note any medications, allergies, chronic conditions, family history, and lifestyle habits. Step 6. Complete screening tests, if applicable. Document any diagnostic screenings, e.g., blood tests, cholesterol, glucose levels. Step 7. Document additional observations. Use the notes section to capture presenting complaints, unique findings not covered by the main sections, additional impressions. Step 8. Patient discussion and education. Explain findings, address concerns, and provide lifestyle or treatment guidance. Step 9. Follow-up planning. Schedule future visits or referrals based on findings and patient needs. Step 10. Secure documentation. Store the completed form securely to maintain patient confidentiality and legal integrity. You can learn more about topics like the physical exam template in our guides library on our Carepatron website. Visit our website and sign up for free. If this video is helpful, don't forget to like, subscribe, and check out more of our content.